When do kids have to start going to the dentist?
The guidelines from the Academy of Pediatric Dentistry say that by their first birthday or when they get their first tooth. For me, I really didn't bring them until the age of 2. The reason is that, obviously I'm a dentist, so I'm checking their mouths.
Right.
And, the guidelines are there for a reason. But at the same time, I think that we know our children best. Even the second birthday is tough because the visits are not always sunshine and rainbows. Kids are going to cry sometimes. It actually helps us when kids cry because they open their mouths and we can see what's going on. We really want to make what we call a dental home for a child. We're bringing them into our practice and we're bringing them into this world where we want them to become great dental patients for life.
Being a mom is the toughest job there is, and it doesn't come with instructions. So it's okay if you don't have all the answers. We'll figure it out together. This is Mom Brain with Ilaria Baldwin and Daphne Oz.
I'm Ruby Gelman. I'm a pediatric dentist in private practice in New York City. I have been practicing for 19 years. I can't even believe that I'm saying that. And I'm also a mom to 2 amazing kids, Ari, who is 9.5, and Avital, who is 7.
I hope that you leave realizing how interesting your field is, because I have so many things and some very selfish reasons that you're here as well. Okay, Yay. So when do kids have to start going to the dentist?
The guidelines from the Academy of Pediatric Dentistry say that kids should come to the dentist by their first birthday or when they get their first tooth. Those kinds of visits, the first visit where there's a lot of talking. Sometimes parents kind of balk at it because they think, well, I'm bringing my child to the pediatrician, and if my child has 1 tooth, what's the dentist going to do? But the idea is we really want to make what we call a dental home for a child. And that means that we're bringing them into our practice and we're bringing them into kind of this world where we want them to become great dental patients for life. So the first visit is really important, but it's not there isn't a ton of hands-on stuff that happens.
No, you guys literally count the teeth and brush them.
We count the teeth and we brush them. Exactly.
No, it was always, I have to say that I haven't been good at bringing them by their first birthday, but maybe by 1.5 right. or 2, then yes. We start coming right. regularly.
So for me, when I talk to parents and my friends, and even for myself, bringing my own kids, I really didn't bring them until the age of 2. The reason is that, obviously I'm a dentist, so I'm checking their mouths.
Right.
And I know that I have that ability to see what's going on. And my friends are all bringing their kids over to me, so I can take a look at their teeth in my kitchen and things like that. But, the guidelines are there for a reason. But at the same time, I think that when we know our children best, and we know that some kids are just not going to have it coming to the dentist before they're 2. 2 is a really great time, I feel, because as much as I hate to admit it, even the second birthday is tough because the visits are not always, sunshine and rainbows. Kids are going to cry sometimes.
Right.
I like to prepare parents for that, and I tell them it actually helps us when kids cry because they open their mouths and we can see what's going on. But the value is that we try to create this really positive environment, and then they build these memories and they know that, oh, the dentist isn't so bad, and I'm going to come and I'm going to get a toothbrush and I'm going to get prizes.
Right.
And then the next visit is better. And
well, you guys also have a really nice, because they have this seat that tilts back, and then they have a TV. Is it on the ceiling?
Yes.
And then they can choose what they're going to watch. And then you guys have really fun flavors of toothpaste too.
Yeah.
So it's, there's a lot of bribery and, sort of urging to make it feel like, and it is really fun. There's very interesting, interactive toys everywhere. But what are, when should we need to start brushing their teeth when they have their first tooth, correct?
Ideally, yes.
Okay. And then what should we be brushing, for both toothbrush and what kind of paste should we be using?
Okay. So again, there are guidelines that we have. I'm going to tell you what the American Dental Association says, and then I'm going to tell you practically what I recommend and what really works well for me. Ideally, we want to brush our kids' teeth as soon as they come in, and with a toothbrush, with really whatever works for you. There are cloths that you can use. You can use a washcloth to wipe off the surface of the teeth. The reason why brushing teeth so early is important is because plaque can start to build up as soon as kids get teeth. And plaque is kind of the enemy of dental health. So we really recommend that, especially when kids are first starting to eat, and even kids who are nursing, especially nursing on demand, where they're really getting a lot of they're getting milk really whenever they want it.
And milk is full of sugar.
Milk is full of sugar.
And then also, what I will do is when I'm breastfeeding, I co-sleep with my babies, and they're nursing in the middle of the night, and then they're falling back asleep. It's like really is the recipe. We have had no cavities yet, but people have told me, I know, right? So far, a clean bill of health. But I've been told that is not good for their teeth.
It really isn't good for their teeth, and I do get parents who come in who sort of have, they have guns blazing and they're ready to fight with me about nursing and nursing on demand for a year or 2 years. And, honestly, it's not my business what they do and what parents do at home. I'm not going home with them and brushing their kids' teeth with them. Right. I'm not putting their kids to sleep. But I'd like to present it to them and explain where the rationale comes from for not nursing on demand, and especially as kids get older, and where they're not able to. And as you know, like if you're co-sleeping with your children, you're sleeping while they're nursing, and you're not focusing on the fact that after they eat, the milk, which has lots of sugar in it, is pooling in their mouths, and it's changing the environment of their mouth, making it really, really easy for cavities to develop. So that's really the whole idea. So sort of disturbing that balance is really what we want. Water is a great neutralizer. The best thing to do is to get in there, even if it's just instinctive, get in there with some kind of a cloth and just wipe off the surface of the teeth.
I think it was you who told me. I was so Rafa. I got pregnant with Leo when Rafa was 6 months old, and so eventually my milk, even though I continued to breastfeed, my milk by the time he was about 10 months old dried up. And I had some milk stored up, but he also did formula for 2 months of his life. And in order to transition him into his crib, I would give him a bottle of formula, and he would put himself to sleep with the bottle, right. Which is like bad. I can see her face. If you guys could see her face right now, if you're watching on YouTube, you can see her face. She's like, no. And I remember, I think you told me and the pediatrician told me, like, you need to stop doing that. Yeah. And so what we ended up doing was I would give him a bottle of water. And to this day, he has a cup of water and he's almost 4 now, by his bed. Yeah. And it wasn't as scary as I thought it was going to be. And it was like the fear of like, I'm pregnant with my third. My first is 2. My second is 1. And I'm so tired. And if you tell me that I can't do what is actually working right now, I'm going to just start crying right now. But it actually, when I took it seriously, it wasn't as scary as the idea was. And it all actually worked out. And kids get used to and accustomed to new things. So breaking that pattern 100%. Is not a bad thing. Fluoride or not fluoride?
So officially, fluoride really is the way to go. In my practice, I really talk to parents about it very thoughtfully. I personally, with my own kids, until they were really able to spit, I didn't use fluoride toothpaste. Actually, I didn't use toothpaste at all. I gave them a toothbrush with water.
Interesting.
The act of brushing itself is really, really important when kids are little. I gave my kids fluoridated water. New York City the water supply is fluoridated, and optimally fluoridated, I should say. And I gave them water and very regularly. And even when they would want sparkling water, We would make it in our soda stream. We really tried to be very mindful of that. As soon as my kids were able to spit, or even in that process of learning how to spit, that's where we started to introduce fluoride toothpaste. The thing is, most kids don't have a parent who's a dentist who is going to get their teeth brushed no matter what.
Right.
And so fluoride-free toothpastes really do present a solution because they taste really good and it makes kids motivated to brush. We're all looking for these magic bullets and things that are going to help us get our kids to brush their teeth happily. The fact is, the best thing to do is to hand them a toothbrush and, just make sure that they know that this is what people do. Now, for a lot of people, they start to brush kids' teeth. They have their kids brush once a day and then gradually working up to where it's twice a day. There are some kids who are brushing constantly 4 or 5 times a day.
I brush my kids' teeth 3 times a day. And
Amazing.
Morning and night, I'll brush them.
Perfect.
And then in the middle of the day, they get to brush them. And
That's
so
amazing.
that's like, because they'll say, well, Mommy, I want to do it. And I'm like, okay, what? I'm not ready for that yet. So I'm going to brush your teeth. And in the middle of the day, they get to go in there and they get to play with it.
It's important because we want to teach kids some autonomy when it comes to brushing. And, when we say twice a day, we really mean like we want them to brush at least twice a day, where we know that very often the nighttime brushing, which is taking place during the whole, pre-bedtime routine, that's happening with a lot of supervision. And so, the morning can be super frenzied and there really isn't a lot of time to do very much. And often parents will tell me that that's the brushing that gets missed and that kids are not brushing during the day. It's wonderful that you're having them brush in the middle of the day because you're really, really teaching them good habits and that they're kind of respecting the fact that they need to brush their teeth.
I do it for myself. So it's one of those things where I'm like, well, you have teeth and I have teeth. We have mouths. Like, we should brush them.
Perfect. I agree 100%. We do what we all can do. And getting our kids to brush their teeth, there's no simple solution. And there are lots and lots of tricks and lots of things. The most important thing is making a habit out of it. And there are parents that tell me that toothbrushing is a total nightmare and that the kids just go ballistic when they're trying to help them brush teeth. And, they ask me, what do I do? Isn't there a solution that's going to help me make them love it?
With Rafa and Leo, because they were both kind of funny about me brushing their teeth, although now they're totally fine with it, is one of their godmothers, her name is Sylvia, she's taught me to look for sugar bugs. Mm-hmm. Oh, there's sugar bugs in your mouth. And they're obsessed with bugs. Like, whatever they're obsessed with, say they're finding it in their mouth. And you're like, oh, my God, I see a cockroach back there. Oh, it's a butterfly. Oh, it's... if you said that to me, I'd be like, puts bad thoughts in it. But they're like, really, really, really? And then they want to see it. And then I'll show it to them. And they're like, wow. Obviously, there's nothing. But, like, in their imagination, there's, like, a cockroach on their toothbrush.
Right. Perfect.
So that has been something. But you know what? Another thing that will work, that works for me with the littler ones is brushing their teeth in the bathtub.
Oh, absolutely.
And that's a really great thing because the whole spitting thing.
Really,
and
really, really well.
A lot of positive reinforcement.
Good.
So, I'll say to, if like Leo, who's 2, who doesn't know how to spit yet, I'll tell him, like, I'll brush, and I'm like, okay, spit. And he goes like, it's like, obviously he's not spitting. I'm like, that was just like so successful. And he looks at me and he's like, yeah, I did a really good job. Yeah, spitting with water, they get really excited for.
Very, very excited.
And especially doing it in the bathtub, it's less of a mess. Okay, so how long should we brush their teeth for?
Ideally, in a perfect world, 2 minutes, at least twice a day. What I say to parents all the time is 2 minutes is something we aspire to. I think 2 minutes can feel like an eternity when you're battling a toddler who doesn't want to have his or her teeth brushed. So I say, try to sing the ABCs at least once, and then gradually you're working your way up to where the kids are appreciating that they have to spend time doing it. We recommend timers, and there are also great apps out there that are really helpful for toothbrushing. So ideally for older kids, 2 minutes.
They also have toothbrushes that will turn off I have one of those. It
Me
turns
too.
off after 2
Me
minutes.
too, absolutely.
And now I have to remember. I'll come up with it. I'll figure out what the toothbrush is. But I just got my kids electric toothbrushes because I was using the electric Oral-B toothbrushes, which I love. But I felt like it was creating a lot of waste. Another question is, how often should we change our toothbrush?
So that's also a great question. So really, ideally, we're supposed to change our toothbrushes every 3 months. The thing is, it doesn't account for the fact that this is the difference here, that most kids today have a lot more than one toothbrush.
Yeah.
And so, if they're changing it up, and that's one of the techniques that parents like to use to get their kids to be motivated to brush their teeth, is they have a morning brush and an evening brush. So I generally say, like, after 6 months, it's a good idea to change.
I think I change it every 3 weeks.
Yeah.
That's excessive, right? You see my type A personality. That's it. I guess that's excessive. Wow. I looked at her like, oh, every 3 months. Are you kidding me? Wow. Well, that's what I liked about getting these, is that you just have to change the head.
Change the head, absolutely.
And then I also find that my kids will chew it. They'll end up, even no matter how much they will chew it, and then it gets like the bristles
So
open.
Once the bristles start to get frayed, then it's totally reasonable to start to think about changing your brush.
Yeah.
It's also a good time to teach kids that they shouldn't be trying to bite their toothbrushes. Right. And it's a little fun, and kids kind of enjoy it. But it's also a great way to teach them to not brush their teeth too hard.
That's all. No, it's funny because with the electric ones too, especially my boys that are 2 and 3 right now, they think it's funny that if they bite it, it stops working, and then they let it. Then they unclench their teeth, and then it starts like vibrating again. I'm like, guys. But this one that I have, it's really great because I think it's every 15 seconds, it like makes like a little like sound.
Yeah.
And I think that's to teach you to like brush a different part of your mouth. I mean, obviously I'm brushing their teeth for them, but for them it puts a different, something is happening during it.
Yeah.
Brushing it while you're reading a book. There's so many different things that you can do. And I think that there is an element, I've found with my parenting, that the more that I go in there and I'm just very assertive, and I'm like, actually, this is what's happening right now. If I let them kind of scare me out of it if they're screaming and stuff like that, and you know what? They might scream, but if I stay consistent with it for a week or 2 weeks, I find that I can usually win them over. And not, I'm not like, pinning them down and like abusing them, but like I'm just like, nope, we are brushing our teeth right now because you need to have teeth. Okay, teeth grinding. This is one of my selfish reasons, because my daughter Carmen is such a teeth grinder, and it makes me worried because I look at her teeth and I feel like they are getting ground down a little bit. We obviously have to, I think our time to come and see you is about now, but I worry because she's at that age. She hasn't lost any teeth yet, so she's 5 3/4, as she was like to say. I think her teeth are starting to get a little bit loose. I'm seeing them shift a little bit.
Yep.
So I think that's probably happening.
Yeah.
She's very anxious for a tooth to fall out because
she probably has a lot of friends who've lost teeth.
She's the youngest in her class, and all of her friends have lost teeth, and except for her. Anyway, so I'm afraid that when her grown-up teeth come in, that she's going to grind them, and we need to be much more careful of the grown-up teeth. So tell me all of your knowledge. Tell me everything.
All of my knowledge. Okay, I'm going to empty my head right now of all my grinding knowledge. So first, I should tell you that most kids grind their teeth.
Okay.
At some point between the ages of 1 and 6. Between when they get their teeth and when their teeth start to fall out.
I hear it when they're coming in, when they're actually teething. That sometimes they grind it because something's going on.
Yeah. And when they're first coming in, it's sort of they're feeling it out because it's something so new. And, when teeth come in, I don't know if you remember when any of your teeth came in or your wisdom teeth came in, they feel kind of itchy and it feels uncomfortable.
Yeah.
So in the beginning, it's kind of trying to figure things out, see the lay of the land when their teeth are first coming in. As kids get older, it becomes a habit where a lot of times we think that there are a lot of theories about why kids grind their teeth.
Well, she does it when she's sleeping, I should say.
So for a lot of kids, it starts with kind of a fascination when they're awake and they're kind of playing around. And then it becomes kind of a nocturnal habit. It's most common when kids are sleeping. Sometimes it's indicative of some sleep breathing problems. Sometimes when kids have a cold, they'll tend to grind a little bit more. So, when I see kids and we see that there's evidence of grinding, we ask all these questions. The reality is there isn't a lot that we do for kids who grind their teeth. And number one is most kids don't really do a lot of damage when they're grinding. Most often, and the sound is horrible.
Oh, it's horrible.
It's so horrible.
Literally like bone grinding. It's horrible.
It's a really horrible sound. Most often, despite the fact that it sounds so awful, it's really just a couple of teeth that are hitting each other, and they're not grinding all of their teeth down to little nubs. I mean, that's, I think, the fear that parents have. Because remember that enamel is the hardest surface in the body. And when you have enamel grinding against enamel, it's going to sound really, really terrible. So a lot of times kids who end up getting adenoids and tonsils removed, a lot of times before that happens, we hear that kids are just grinding relentlessly, and then once they've had these things taken care of, the grinding ceases. I can vouch for the fact that both of my kids were in this category. They were terrible grinders, and then both of them, at the age of 4, each of them had their adenoids and tonsils removed or shaved down. Adenoids are that tissue that's inside the nose that it can cause some constriction and some restrictive breathing. So it makes it difficult to breathe through your nose.
Oh, okay.
All this, it's really interesting because in dentistry in general today, there's a lot of talk about the dentist's role in what they like to call sleep disordered breathing. And, a lot of it is about sleep apnea and about breathing through your nose and how important it is. So it's a pretty big
We talk about that
topic.
in yoga too.
Well,
I mean that the nose has a filtration system and the mouth doesn't. People I'm a big runner, and people say, "Oh my God, I would love to run, but it's so uncomfortable." And I've had 4 babies in 4.5 years, so I've gotten not running out of shape, and then have to get back into shape again, and it's horrible for me too. Your lungs burn, your legs burn. It's horrible to do that. But what I do is I've taught myself how to breathe. Yeah. So I will only breathe through my nose, and then I can breathe out of my mouth, but I won't inhale through my mouth, because when you inhale through your mouth, you're drying out your lungs, you're drying out your throat, and that creates that burning sensation and then puts your body into fight or flight, and you get really stressed out and you think that you're dying, and you're not, because you're just running, and it's all okay. But breathing through your nose is extremely important. There's this really great book called Science of the Breath that we read in yoga training, and it's very interesting because it talks about sort of Eastern and Western philosophies, or like lack of philosophy for Westerners, about breathing, and even how they'll tilt the child's face down a little bit, tilt their chin down when they're sleeping to encourage their mouth to close and everything.
Definitely,
it's very, very interesting.
Yeah, it's very interesting, and it's also, what's interesting to me about when we see kids who can't breathe well through their noses is that it really actually changes the shape of their mouths, because when they're breathing more through their mouths, they end up, because your body is sort of adjusting to the fact that you are, so the palate starts to shift a little bit, and it creates these orthodontic problems. And,
interesting. And
even from very young ages, so all of these things tied together have really made this topic in dentistry very big, and really the dentist's role in helping to diagnose breathing issues in kids. It's interesting that you also hear that parents will come in to the dentist, and very often dentists are seeing kids more often than their pediatrician. When you have kids who are very healthy, and parents are bringing their kids to the dentist twice a year,
right?
So we'll talk and we'll make an assessment. I'll take a look in a child's mouth, and we'll see that the tonsils are very big. And it might be in the middle of the winter time, and it's kind of common to hear that the kids are, because of cold season, having colds. And exactly. But, I very often will recommend visiting an ear, nose, and throat specialist almost more often than their pediatricians, just because I'm seeing them at a time where a kid might have a cold and they're not going to the doctor because it's just a cold, and they'll be fine after a couple of days of sniffling. And then, I cannot tell you how many parents come in for their follow-ups and say, thank you so much for telling me to go, because now I understand that there's this connection between the mouth and the rest of the body, and that the breathing through your nose is so important.
That's so interesting. Now, how do you know if the adenoids, am I saying it right, the adenoids need to be addressed?
So again, this is something that an ear, nose, and throat specialist takes a look at. A lot of times they happen simultaneously. So if it's something, if you're hearing that your child is very nasal, that that it's happening really at times when it wouldn't necessarily be expected, like in the summertime, or when and again, like an ENT is someone who really specializes in all of these things, and they can make assessments and say, well, you really need to see an allergist, or they may recommend certain kinds of medications that help to shrink all these tissue, because that's what it is. That's what tonsils and adenoids are. They're soft tissue that just, they can get kind of inflamed and bigger and making it difficult to breathe.
Mm-hmm. No, but would you also notice that if your kid isn't sleeping well? Because my daughter sleeps like a rock. You literally could turn the lights on and have like the biggest party in her room, and she will not hear anything. My boys are like, the wind blows, and they're like, "What? Whoa, what was that?" Yeah. But she sleeps but then the grinding of the teeth is just like, how does this not wake you up?
Right. So, if she's sleeping well, then that's a very good thing. I think what we do find with teeth grinding is that once the new teeth start to come in, it actually dissipates. Okay. And the reason it does is because things come in a different position. And really, once she gets her adult molars, which we call them 6-year molars, they generally come in sometime around the age of 6. So you have that to look forward to soon.
Great, teething again. I'm so excited.
You're going to have nonstop teething in your house.
Yeah, right.
So once they come in, they kind of lock the bite into place. We hope that once they come in, and I know that Carmen has a really nice bite, so that once they come in, we hope that the grinding actually starts to subside.
Oh, I hope so, because I look at her and I'm like, when you're like, your grown-up teeth come in, I'm so worried for them. Okay, so talking about positioning of teeth, and then I want to get into a little bit of teething for like babies. Mm-hmm. So we like jump all over the place. I have awesome. No rhyme or reason how we do it. I'm just picking your brain.
I love it.
And okay, so positioning of the teeth. So my daughter's teeth, and actually Romeo's teeth as well. So my first and my fourth, they came in, the two bottom ones came in, and hers pretty strongly at a V, which is interesting because I see it pretty common with some other people. And you notice what your children, your child has.
Of course.
So I'm sure I'm seeing it probably much more than it is. I'm like, wow, your kid has teeth like that too. But it's interesting because neither Alec nor I had braces, and we have very straight teeth. And I've been told multiple things that could be, could mean that she's going to have braces, and he's going to have braces, or it could mean absolutely nothing.
Right. It really could. It's very hard to tell. I cannot tell you how many people come in to me with a 3-year-old or 4-year-old and say, "Is my child going to need braces?" And
like, you know what?
Like, if I had a crystal ball, I would be really happy to tell you. But the reality is, like, kids are individuals, and while they come from our genetic material, what happens when things get combined, we don't know. We know that there is definitely a genetic
correlation,
predisposition to if your parents had braces, chances are you're going to benefit from braces too. I think today the world of orthodontics, which is straightening teeth, has really changed a lot, and it's really hard to find a kid who wouldn't benefit from
braces. I think I probably would have benefited from braces, but it was one of those things where
your
my parents
were
like, no, they're very straight. They're a little crooked on the bottom, but it was one of those things where I think my parents were like, we're not going to pay this money. You're fine. It's good enough. It's good enough. It's fine. I think now that most children get braces. What's the typical age when they get braces?
So, there are different philosophies about treatment. Sometimes orthodontists like to treat kids in 2 different stages. So they'll end up where the kids around 8 or 9, if a child looks like things are a little wonky, or, where we see that the bite is a little bit off, sometimes we'll send kids to the orthodontist for an evaluation. And sometimes they'll do something called the palate expander, which is something that helps to stretch the jaw. It used to be back in the dark ages when I had braces, it used to be that the thought was that you would just take out a lot of teeth. You take out a lot of baby teeth, and then you take out adult teeth, and then you just sort of bring everything together, and that's how you create a perfect smile. But the more modern thinking is that it's actually better to change the landscape of the mouth, and you create more space so that things have more room. So it's done kind of in 2 phases. We do it once, we do this kind of orthopedic stuff where you're moving things around. And it's a shorter course of treatment, around sometimes 8, 9. A lot of it depends on a child's dental development. Some kids, it's a great example. My son is 9.5, and he's lost all of his baby teeth, which is total insanity. Most kids.
When do you lose your baby teeth?
Most kids lose all of their baby teeth by the time they're 12.
Oh, okay.
And it happened. It didn't come from me. I was a kid who. I had to have 11 teeth taken out when I was a kid.
This is why you became a dentist.
It's one of the reasons. I'm much nicer than my dentists ever were, for sure.
I'm sure you are. I can speak from experience of us coming here.
But
very nice.
my mother-in-law told me that my husband lost his teeth very early. And so that's probably where it comes from. And so I have a kid who really is almost ready for braces. And, today there are lots of different ways to treat what they call malocclusion, which is where our teeth don't fit together properly. There's traditional braces still, which are wires and brackets, and they have all the different colors that they can put on. And Invisalign is something else, which it's very, very popular, and it's
for kids.
So it's interesting that today there really is this shift where a lot more teens and tweens are getting Invisalign.
They don't want to be walking around with a mouth full of. But sometimes I see like 8-year-olds with braces.
Yeah. So what happens where kids have braces in 2 phases, or have orthodontics in 2 phases, a lot of times they'll start with some kind of an appliance where they're stretching things, and then they'll have braces. And it'll be really cute. They'll have braces on the 4 front teeth. It'll be for a couple of months, and then they'll have a retainer until a retainer is an appliance that just kind of keeps things from shifting around and allows you to hold off and wait until everything falls out. And then they evaluate it again when kids are 11 or 12, once they've lost all or almost all of their teeth. So it's really interesting where Invisalign comes in, and there are other kinds of treatment like Invisalign, where it's these plastic aligners that help to do the same thing that braces do, but you take them out. So you don't eat with them. Adults and children, you don't eat with them.
Well, same thing with Invisalign. You don't eat with them either. You have to take them out.
Right. So braces you leave in, but Invisalign you take out, and you also can brush your teeth with them out, which is, for us, like as pediatric dentists, we're trying to teach our patients how to be amazing toothbrushers. So when they get these mouths full of metal, it's really hard to keep your mouth clean. So that's why Invisalign theoretically is terrific. What we're finding is, kids they'll eat their lunch, and then instead of rinsing their mouths, they're not going to brush their teeth at school after lunch. Most kids won't. They're just sticking their Invisalign back in, which are creating problems.
There's this teen who told me, she's like, yeah, I did Invisalign, but the last one I didn't, because it just started smelling so bad. The tray, I was like, oh God.
Yeah. Right.
It's a little bit of learning to take care of yourself at that point.
And that's a big thing. My son, he's almost 10, and the orthodontist said, well, he can have Invisalign. And I laughed because my son would forget his head if it wasn't attached to him. So I couldn't imagine putting that responsibility on him, that he has to remember to take these things in and out
and take care of it
he'll
and
throw
rinse
them
it
away.
and everything. When to start flossing? The flossing conversation.
Flossing is a very big deal in my office. We're giant proponents of flossing. So the simple answer is once kids have teeth that are touching each other, that's when you start flossing. Now, for a lot of kids, their baby teeth, most kids get all of their baby teeth. There are 20 baby teeth. Most kids get all of them by the time they're 3 years old. And the most common place where we see cavities forming are between the molars. Now, the molars come in generally between the ages of 2 and 3. So it doesn't take a long time for cavities to start to form, and where they're forming is between the teeth. So one great safeguard is to start flossing. Flossing is just mechanically removing debris and plaque that forms between teeth. Now, some parents look at me like I have 3 heads when we talk about flossing.
Especially if they're having trouble brushing their kids' teeth.
Of course,
like you add flossing
Yeah.
on top. They're like, okay, no more milk at bedtime, brushing teeth and flossing. Thank you very much. I'm leaving.
Definitely. So, it's all part of this like preventive focus. And, my practice is very, very focused on prevention. And so I would be the happiest dentist in the world if my patients didn't get cavities. And so we're presenting all these things, and we really aim to teach kids in our practice, teaching kids how to floss independently by the time they're 9 years old. And it's challenging because when kids are younger than that, it's really hard for them to have dexterity to be able to do it themselves. So we really rely on parents.
Yeah.
But there are flossers that are fun to use with kids, and it definitely increases the time that toothbrushing takes. But it's so valuable, and it doesn't have to happen every day. Certainly in the beginning. If you can do it twice a week, that's awesome.
No, but it's also how I always think about it with this preventative thing is it takes 10 seconds to floss a kid's teeth, maybe 20.
Yep.
And if that's going to help you not have to go and get a tooth drilled or whatever the process is of having a cavity filled at this point, it's so worth it. Teaching them good habits. I think it keeps them from getting as sick, just even common colds and stuff like that. Keep the mouth clean. Mm-hmm. And as they get older, especially with their adult teeth, that's it. That's what they have for the rest of their lives. And it's so, so, so important.